Hi, I'm Hayley, owner of Body Motion Exercise Physiology, and today I wanted to have a chat with you about the exercise benefits of some common chronic health conditions. So first of all, what is a chronic condition? Simply put, it is a condition with lasting effects persistent on the individual. It is the leading cause of disability, illness and death in Australia. So while there are many common chronic conditions, some are more common than others. So today I'll be covering type 2 diabetes, hypertension, dyslipidemia, osteoporosis, arthritis and depression. And all these conditions have one thing in common. Being overweight or obese is a risk factor for each of these conditions. Furthermore, each of these conditions are a risk factor for developing cardiovascular disease. So let's jump straight into it with type 2 diabetes. And physical activity is a key management tool for any diabetes and can assist in preventing diabetes health-related complications. The benefits of exercise with this condition are improved glucose tolerance and insulin sensitivity, decrease in HbA1c, so your glucose blood levels, and a decrease in your cardiovascular risk factors. It also aids in weight management. So the exercise recommendations for type 2 diabetes are we want to be doing 3 to 7 days of cardio exercise, and this might be walking, swimming or bike riding. We want to do this at a moderate to vigorous intensity, and this is dependent on the individual, their age, their fitness level and where they're coming from. Then we're also wanting to do some resistance training, so free weights or machine weights 2 to 3 times a week on non-consecutive days. Now we're going to jump into hypertension, and this is considered a blood pressure over 140/90 on 2 separate occasions. And primary hypertension accounts for 95% of all cases and is a major risk factor for developing cardiovascular disease. The exercise benefits for hypertension include a pre-treatment for pre-hypertension before any prescription is prescribed. So if you've been to a GP and you've been advised that your blood pressure is a little bit high, they generally will be encouraging you to jump in and start some exercise, as this can bring your levels down. So chronic exercise, so long-lasting exercise programming can actually bring your blood pressure numbers down by 5 to 7. And then cardio exercise is also been shown to reduce your systolic blood pressure. Resistance exercise is inconclusive as to whether it will help drop your blood pressure, but there is a whole host of benefits for taking part in resistance exercise. So the actual exercise recommendations are cardio 5 to 7 days, and we want to be doing this at a moderate intensity, at least 30 minutes every day. Then we're also wanting to pair this with our resistance training, so free weights or machine weights 2 to 3 days on non-consecutive days. And where you start depends on your age and your current fitness level and what you're already taking part in. Next, we're going to look at dyslipidemia, so high cholesterol. And nearly 30% of Australians have high cholesterol, and it is a major risk factor again for developing cardiovascular disease. It is caused primarily by poor diet and inactivity. Genetics does also play a large role in developing this condition, and lifestyle changes are the foundation for treatment with dyslipidemia. The exercise benefits are increasing our good cholesterol and decreasing our bad cholesterol, as well as weight reduction. And with this, we are wanting to try and increase our energy expenditure every day. So we're wanting to do aerobic exercise, so our cardio exercise at least 5 days a week for a minimum of 30 minutes per day to increase that caloric expenditure. So the more energy we burn, the better it is for this condition. Plus, we are also wanting to pair this with our weight training. So this could be free weights or machine weights, 2 to 3 days again on non-consecutive days. But we are wanting to try and build an accumulative physical activity of 50 to 60 minutes each and every day to manage this condition and try and avoid progressing into a cardiovascular disease. Next, we have osteoporosis. And recent evidence suggests that exercise can actually delay the onset of osteoporosis and reduce risk factors. So if someone has been told they have osteopenia, so this is the pre to osteoporosis, if you jump in and do exercise, and particularly weight-bearing exercise, This can actually reduce your chance of progressing into full osteoporosis. But the sad thing is that nearly 1 in 2 women in their life will experience either osteopenia or osteoporosis. So the benefits of our exercise are, as I said, it can delay the onset of osteoporosis. It also can increase your balance, which decreases your falls risk. And falls are one of the biggest problems with osteoporosis because it has a high rate of fracture, especially hips is very common. It also helps improve our bone density levels. So as far as exercise recommendations, we're wanting to do our cardio exercise, but the difference is we're wanting to try and promote bone loading. So we're wanting to do things like stairs, walking, bike riding, and we're wanting to do it 4 to 5 days a week for at least 30 minutes per day. And then we're wanting to do 2 to 3 days a week of our resistance strength exercise on non-consecutive days. But exercise prescription is key here. We are wanting to load the bones while also remaining safe. So someone who is diagnosed with osteoporosis doesn't want to be doing too much twisting through their spine, especially if they have been told that their bone density levels are low in their spine. We're wanting to avoid any further risk of fracture. We're wanting to load those bones to promote bone remodeling to reduce the risk factors. So we're wanting to, so depending on the individual, age, fitness level and current activity levels will determine what specific exercises you take part in. Next, we have arthritis, and there are over 100 rheumatic diseases, the most common being rheumatoid arthritis and osteoarthritis. So osteoarthritis is a local degenerative joint disease, and this is caused by injury, repetitive action of high intensity over years, so it's wear and tear on the joints. Then we've got rheumatoid arthritis, which is an autoimmune condition, which is when our body is attacking our joints. So both of these have major benefits of exercise. So with exercise, we're going to increase muscle mass, which increases the support on our joints. It also reduces the comorbidities for inactivity, such as cardiovascular disease, type 2 diabetes, and metabolic syndrome. When it comes to your exercise prescription, again, we're wanting to do cardio each week, 3 to 5 days a week, moderate intensity. And this can be, again, whatever you like, but swimming, if you've got a lot of pain, can be really good because it reduces the pressure on the joints. Then we're wanting to do weights, so machine or free weights, 2 to 3 days a week on non-consecutive days. And the thing is, research has shown that persistent exercise planning and prescription has been actually shown to reduce inflammation and decrease inflammation and the pressure on the joints and reduce the pain response that you experience in the affected joints. And this common thing with arthritis and osteoporosis is many individuals get scared about starting exercise, especially if they've been inactive before. But it is actually highly recommended to start exercising. You just need to make sure that you have the right prescription and the right advice as to what is safe for you to start. So lastly, we're going to finish on depression. So exercise is a behavioural intervention that has been shown great promise in alleviating symptoms of depression. Research has also shown that depressed patients are less fit and have a diminished physical capacity. Research also suggests that regular exercise may be effective in preventing depression and also treating mild depression. So the benefits here are huge for exercise. So improved fitness levels helps to boost your mood. It also promotes better sleep, and better sleep also promotes a better mood. It also increases energy levels and decreases your negative thoughts. Group fitness is also great because you are increasing your fitness and building strength, but you also have that social interaction as well. Then exercise can also alter the chemicals in the brain, such as increased serotonin and endorphins, so your happy hormones, and increase your stress hormone response. As far as the exercise prescription goes, it is much the same as for a healthy adult. So we're wanting to do at least 5 days of moderate cardio exercise or 3 days of high vigorous activity. But again, this is dependent on the individual and your current activity levels and fitness levels. We're also wanting to train strength 2 to 3 days each major muscle group. And again, prescription is key. It's just depending on your health, your current fitness levels, and having the right advice. So the take home from today is that targeted exercise interventions are paramount for treating, managing, and preventing a wide range of chronic conditions. So your goals from here. I would love it if you could speak to your friends and family and encourage physical activity and tell them about the benefits for so many conditions. If you yourself aren't an active individual, I would love it if you would try just 1 to 2 small walks in the next week and start building from there. And then lastly, seek professional guidance for an assessment and a personalized lifestyle program that is suitable for you and your condition. So if you have any comments or questions, feel free to pop them down below and I would love to have a chat with you and help you out.